So we've just concluded a 2-day screening in Nyakach sub-county, Kisumu County. So the last 2 years have been very difficult due to the COVID situation, where there were restrictions about mass gatherings. So we've not been doing as many screenings as we did before. But since the foundation started its screening activities, we've seen just over 30,000 people in 25 of Kenya's counties. So we resumed screening in May 2021 as we observed the COVID situation. And this year alone, in 2022, this is our third screening where we're offering free cancer screening services for breast, cervical, and prostate cancer. The other thing that we do is that we approach cervical cancer screening using the see and treat method as recommended by the National Cancer Screening Guidelines. See and treat means that any woman that is found to have precancerous lesions of the cervix is treated on site right before they get off the medical examination couch. They are attended to. So the treatment takes just about 2 minutes, after which the woman is free of cervical cancer for 10 years. We do recommend that they continue with screening, but when the treatment is done, we also ask them to come to the health facility for a review a month after, and that we were able to stop the progression of precancerous lesions into full-blown cervical cancer. The thing about this model of treatment is that we make sure that the woman is seen right there and then, as opposed to asking them to go to a health facility that possibly has a cryotherapy machine. Most times they will not go, because even when they came to us, they were not in pain, maybe a bit of discomfort, and then they're probably in shock when they hear that they have precancerous lesions of the cervix. So ideally the nurse, after finding out that there are lesions in the cervix, will counsel the lady, will tell them about the treatment, tell them the benefits, and also the aftercare after treatment. We found this model to be very beneficial because we ensure that all the women we see can be treated, and the ones that have a lesion that is bigger than what can be done by thermoablation, we partner with treatment facilities to ensure that they can get something more advanced, in most cases maybe LEEP or an advanced test for cervical cancer to establish what the issue could be.
Here is the Liga, the device I'm talking about, and here it also has a battery. You don't need, you charge the battery and you work with the battery. You can work with it. The advantage of this one, you can work with it and treat anywhere, so long as the battery is full, and it can treat up to 100 clients when the battery is full. Here I can demonstrate on how the device is being used. This one is the battery. You put it like this here. And then we also have some probes. This one we have four different types of probe, and use the probe depending with the size of the lesion you have seen, the cancerous lesion. Others have big lesions, others have small lesions, and also it depends with the type of the lesion you have seen. So if the way you can see it, there is a flat one, and we also have another one with a tip. And this one, you use it when the lesion has extended inside the os of this. The cervix looks like this. When the lesion has extended inside the os, you can use this one so that it can treat even the inside one. But when the lesion is just around here, you can use this one, a flat one. And it works. It only takes 20 seconds. It's a very good device because it only takes 20 seconds to use it. You just put it like this. Then you press here to put it on. Then you just you insert it inside where the cervix is. Then you just press it again. Then it usually have some lightings here, and it treats only for 20 seconds. So you'll be seeing some lights here. It will start 5, 10, 15, and 20. Then after that, it is just over, the treatment is over, then you remove it, depending with the lesion.
We would like to appeal to organizations and individuals who would like to support Africa Cancer Foundation's work. One of the things that we do need is more thermoablation machines. We do find that sometimes we have more than 5 screening rooms. We're seeing more than 1,000 women in a day, and in the event that a lady is found to need treatment, then that room is closed for about an hour because she will need counseling, she will need the treatment and post-treatment counseling. And so if we had more devices, we would do a lot more and reach a lot more people. It would also mean that we can have different camps in different areas and not have to depend on a single thermoablation machine for the treatment.